When you look at those trials, the Mr. Clean trial was the one, let's say, the most simple trial. We only demanded a non-contrast CT scan, which you need because you have a patient with a stroke. You don't know whether it's a hemorrhagic stroke or it's ischemic stroke, so you always need to do a non-contrast CT scan. And the only additional thing we demanded was a CTA. When we look at the other trials, the ESCAPE and Extend IA, they did all kinds of new imaging technologies, which meant that the patient population they select is a subgroup of the patients which were included in the Mr. Clean trial. So when you look at all those trials, it's clear that endovascular therapy is beneficial. It's working. It's beneficial to the patients. But I think the most important thing to highlight is that we have the widest range of patients being treated in our trial, and when we do a subgroup analysis, we see that it works in all those different subgroups. So you can say that within the 6-hour time frame which we all used in all the trials, you can say that we showed that this endovascular therapy is beneficial for all patients included, and you don't need to do per se the additional imaging tricks, let's call it like that, they did in ESCAPE and Swift Prime or the Extend IA. Well, you do have to have the facility to do a CTA, and that can be a problem. But then again, it's much more easy to do a CTA than the other imaging stuff. So what needs to be done, in my opinion, is that we need to look at the different regions, and I'm sure that the regions in the United States are different than the regions in Europe and in the Netherlands. But for instance, in our region, in the Netherlands, surrounding the Amsterdam region, we are now asking our regional hospitals, can you perform 24/7 a CTA? And if you can do that, can you upload those images to our center, where the interventional neuroradiologist can take a look at those pictures and decide whether they can do the procedure or not. In that way, we can serve the hospitals, and we can tell them, this is a patient we can help, please send them in as quickly as possible. We can be ready when the patient comes in to do the procedure as quickly as possible, and afterwards the patient can go back to his own regional hospital. We have to be as quickly as possible. And I think, but when we look at the nearby future, the largest challenge is that we have to establish a logistic infrastructure, regional infrastructure, to get those patients as quickly as possible to the intervention centers, have logistics optimized in the interventional centers to do the procedure as quickly as possible. And that's a major challenge. Time is brain, time really is brain. Today we presented at the conference analysis looking at the factor time to procedure, time to reperfusion, and it's clear that when you are really fast, you have a much better chance of a good recovery than when you are at the later time intervals of let's say 5 to 6 hours. The region where I live, it's quite simple. In Amsterdam we have, well, I always say we have a hospital on every corner or every street. It's not true, but we have a lot of hospitals. So that's not fair. When you live in the US, in the Midwest, then you have a problem. When you get a stroke over there, you have large distances to cover. And when you end up in a nearby hospital, the question is, can you receive over there intravenous TPA? And how on earth are you going to be transferred to an interventional center? And that's why I think that's a challenge. And I think that doctors living in that region, serving that region, should discuss with one another, how are we going to solve this problem? How on earth are we going to serve this region? So there are all kinds of things to think about, and we're moving forward, and we're making progress. This is really a conference in which we show that there is, well, we made a major leap forward. It sounds a little bit overdone, but really I think it is. The last time I saw such a major progress was when we introduced intravenous thrombolysis, which is 20 years ago. This is again a major step forward, but there are many challenges that we have to face and to overcome.